Okay. Can you see PPTs? You see me only or presentation as well? Yes, exams in our university are online, as you know, right now, or in the university with the computer. Computer have specific program in which is given some kind of true and false, where it's only two options, or true or false question. Is here multiple choice where answer can be more than 4, 6, 7, 8 as well, but only one is right. And the multiple answer where answer right answer can be not can be must be more than one. It can be 2, 3, 4, 5, or all of them. All the options. Understand? Okay. Yes, I think most of your answers are right, but not full. You take only one option maybe, or two, and must be more, 3 sometimes, or if you choose only one, it can be 2. That's why your marks decreased. No problem, now you will know, and we have another midterm and final, so no problem, my dear. Okay, great. Now you understand what's happened in the exams. So, what is team, my dear? How can we describe what is team? Team is a group, a group of people. What kind of people? People or units organized to do a task together. They are organized to do something together. But what kind of team can be? Let's see. First of all, let's speak about the word interdisciplinarity. Interdisciplinary team. What it means? It's a group of healthcare professionals from diverse fields who work in a coordinated fashion toward a common goal for the patient. So once again, diverse field, yeah, and work in coordinated fashion. Why? Because has common goal. Okay. Intra-professional team. Inside one profession, inside one profession, it's a team of professionals who are all from the same profession, such as 3 physical therapists collaborating on the same case. Can it be? Yes. Consulting sometimes need more than one professional. If some issue is difficult, we ask help for another professional. Okay, so interdisciplinary, intra-professional team. As well can be said multidisciplinarity, a team of professionals including representatives of different disciplines who coordinate the contribution of each profession, which are not considered to overlap. In order to improve patient care, who can be multidisciplinary team? Here can be not only physicians, nurse, physician, who else? Here can be IT department, computer professionals. Here can be builders as well, why not? Here can be other kind of professions who help us to improve patient care. How? IT can improve it, IT is person who works with computers and help us with computers. Yes, you remember we have this kind of in our university. So if I need some cooperation with other team, I will ask my IT to help me. Should you do it again, you have to send a mail to exam office and to Salome Chiburdanidze with description why you write wrong, that no one gave you explanation about the exam. If they will check and on our portal is no description of exam, let's see, but I do not think. My dear. But by the rule, you can't write this to person with description and with asking for help. Okay, as I see another person, Edison, hello. So Edison, what about your exam? Edison, wake up. No, it was not. It was not hard. It was strange because, yes, we spoke now and discussed this exam with another our student that here is multiple answers that shock you, maybe as well. All questions, every question is part of the presentation. No word is changed from the presentation. It's given perfectly from the slides. So do not say it to me that it's hard. Okay, and we continue. We speak about the collaboration and the professional teams. So we spoke about, which one, my dear? We spoke about interdisciplinary, intra-professional. Now we speak about the multidisciplinary team, which can be not only from the medicine, but other portions as well will help us to improve the patient care. Can be a rehabilitation team as well. The individuals involved in establishing a plan and goals for the achievement of patient maximum potential. The composition of the team will vary depending on the nature of the patient problems. The patient is always included as a member of the rehabilitation team. So what is here very interesting is that we take our patient not like a subject, yes, but a member of our team. Let's add presentation here to you. And I think you will see it now. See, my dear? So, team is group of people or units organized to do a task together. We have interdisciplinary, intraprofessional team, multidisciplinary, rehabilitation team, where the patient is a part of team, and we discuss with the patient processes and way of working. Transdisciplinary team. Now look, it's a multidisciplinary team of professionals, including representatives of the different disciplines, who coordinate the contribution of each profession, which are not considered to overlap in order to improve the patient. And now it's transdisciplinary. Trans, it means changing, yes? Let's see. A team composed of members of a number of different professions cooperating across disciplines to improve patient care through practice or research. So if multidisciplinary, it means that I will give treatment to my patient as well. I will take him clean blankets, which help me to take care as well. Here will be conditioner maybe of the ear and so on. Yes, it's multidisciplinary, and all of this moment will help me to improve the patient. Transdisciplinary, I think very common. It can be about the medicine as well, but I take very common to you to understand what it means. Transdisciplinary means that if your patient has some fracture of the hand, maybe, I will take neurologist, traumatologist, and surgery. So this is three different person, but somehow it's cross-disciplinary. So when I speak about the fracture, surgery can help. Maybe surgery with fracture, muscle and nerves problem is always when we do some treatment for the fracture and so on. So trans means more close to us. So what is interesting that nowadays we have big team in the hospitals. Here is some registration, then some helpers, nurse, professional physician, and so on. Yes, some skill kind of changing. But for one patient, sometimes it's more than 10 person who help to treat this person. So what to do, how to cooperate? It's very difficult, my dear. At first, in cause, every person, every individual, when you listen, you take your words in different cases, in different way. You say one kind of thing, he get another. What it means? It means that here will be misunderstanding. And can you imagine if you speak with 10%, all of them will misunderstand you maybe, and 10 different ideas will exist how to treat person. This is first. The second is that that person doesn't matter who he will be, your colleague, physician, or nurse, or other kind of, always thinks that has more ideas about the, if not disease, about the treatment of person in this disease. So he, with his best wishes, want to help you, but cannot. Why? Because it's against your way of treatment. You take maybe some medicine and your colleague want to help and know that this medicine must be done in the morning, but think, doesn't matter. He sleeps so sweet, so why I have to wake up this patient? Because in the sleep period he recovered as well. So I will take this medication to the patient 2 hours later. It will not make a change. He thinks so. In one side, if medication can be given in the range of between 2 or 4 hours, it can work. But if medication is prescribed so precisely, yes, so you cannot change it. Like in the diabetes person, you cannot change the time of giving glucose, or you will kill your patient. Understand? Yeah. But your colleague want to do it in the best way for you, for the with the best wishes to the patient and to you. You want to help. Is it a good way? I do not think so. What to do? No one knows. Let's read what we have in presentation and then discuss these parts, okay? As we do always. In today's healthcare system, delivery processes involve numerous interfaces and patient handoffs among multiple healthcare practitioners with varying levels of educational and occupational training. During the course of 4-day hospital stay, a patient may interact with 50, I say about the 10, and here in our presentation is given that can interact with 50 different employees, including physicians, nurses, techniques, and others. Effective clinical practice thus involves many instances where critical information must be accurately communicated. Team collaboration is essential. When healthcare professionals are not communicating effectively, patient safety is at risk for several reasons. Let's see which kind of reasons can be lack of critical information, misinterpretation of information, unclear order over the telephone, and overlook changed in status. Now, give me explanation what's happened. No one can explain me what is given here in our presentation, that when it's a lot of people, 50 different employees, yes, who our patient can communicate with, here will be misinterpretation of your words, as we spoke. I speak with you that must be, I don't know, must be taken this medication, taken into the laboratory and so on. So you misinterpreted it or forgot something or take to another laboratory and so on. Lack of critical information, what it means. What mean unclear order? Yes, for sure sometimes happens that in Russia it will say only, this patient take their temperature, his temperature. I want to know his temperature. It's unclear order. I want to know his temperature. My employer, my colleague can take like ideas that through the day, once temperature must be measured and then sent to me by mail, maybe, which I will read maybe on another day. Yeah, it's unclear. But I need perfectly right now in front of another medication to understand increase or decrease the dose of medication, maybe. Yeah. So it's unclear order that makes some problem to my patient. Overlooked changes in status. Let's see. Lack of communication creates situation where medical errors can occur. What kind of errors can occur? These errors have the potential to cause severe injury or unexpected patient death. Can you imagine? Medical, as I say, if your patient is sleepy and maybe nurse with the best wishes want not to wake him up for medication. If it is something that can be given in the range of 2 or 4 hours, does not matter. But if it is something like hormones or other kind of, which must be taken perfectly on time, like in diabetes as well, yeah, So, or some disease of the kidney, you have to do it on time, perfectly. Or it will be unexpected patient death. Medical errors, especially those caused by a failure to communicate, are a pervasive problem in today's health care organization. According to the Joint Commission, he is given formerly the Joint Commission on Accreditation of Healthcare Organization, JCHAO. If medical errors appeared on the National Center for Health Statistics list of the top 10 causes of death in the United States, they would rank number 5 ahead as accident, diabetes, and Alzheimer's disease, as well as AIDS, breast cancer, and gunshot wounds. Can you imagine? So the more persons are involved in process of care, patient care, the more errors, the more problems can exist. Which kind of errors? Medical errors, yes? Which can lead to the patient death. It's named medical errors. Once again, is misinterpretation, lack of critical information, what can happen if you change something, unclear order, over the telephone is given here, overlook changes in status. So maybe something changed in the status of patient. So he is on the another step of the treatment, but you miss it and give the previous dose and previous medication, which is now harmful to your patient. Understand? Yeah. So once again, according to the JCHAO, if medical errors appears on the National Center for Health Statistics list of the top 10 causes, top 10, my dear, of deaths in the United States, they would rank number 5 ahead of accidents, diabetes, Alzheimer, AIDS, breast cancer, and gunshot. Dramatical kind of. Here is some statistic portion. Let's read. In 1999, Institute of Medicine (IOM) report to Earth Human, building a safer health system, revealed that between 44,000 and 98,000 people die every year in United States hospitals because of medical errors. Even more disturbing communication failures are the leading root cause of the essential events reported to the Joint Commission from 1995 to 2004. More specifically, the Joint Commission cites communication failure as the leading root cause for medication error, delays in treatment, and wrong site surgeries, as well as the second most frequently cited root cause for operative and post-operative event and fatal falls. What I can say here, nothing new, my dear. Here is only statistic portion, and you understand how fatal and how problematic is communication. So, what kind of team can be and what kind of communication can be? Let's think once again. Interdisciplinary, intraprofessional, multidisciplinary, transdisciplinary, and rehabilitation. Of course, we mainly focused on intra-professional team. What it means, intra-professional team? Professionals who are all from the same profession, such as three physical therapists collaborating on the same case. We will read all of this portion and then speak about the intraprofessional, not separately, but more deeply. Okay? We spoke about it. It is important to point out that fostering a team collaboration environment may have hurdles to overcome. Additional time, perceived loss of autonomy, lack of confidence or trust in decisions for others, clashing perception, territorialism, lack of awareness of one provider of the education, knowledge, and skills held by the colleagues from other disciplines and professions. However, most of these hurdles can be overcome with an open attitude and feelings of mutual respect and trust. A study determined that improved teamwork and communication are described by healthcare workers as among the most important factors in improving clinical effectiveness and job satisfaction. You understand something from this portion? Yes, something given that a lot of problems can exist, yeah? Okay. Extensive review of the literature shows that communication, collaboration, and teamwork do not always occur in clinical settings. For example, a study by Sutcliffe reveals that social, relational, and organizational structures contribute to communication failure that have been implicated as a large contributor to adverse clinical events and outcomes. Another study shows that the priority of patient care differed between members of the healthcare team and that verbal communication between team members was inconsistent. So, when the team consists from more than two persons, you have to think how to communicate with others, how to speak, how to describe your ideas. When we spoke, you remember doctor-patient communication. We always speak about that must be something easy way to communicate and to understand to patient. But the same must be to our colleague as well. Where here will be intra-professional as well. I do not speak about the interdisciplinaries, intra-professionals, the same profession. So three of you, three students from one group maybe, will speak about the one subject, it will be 3 different ideas. So, without any kind of arguing, you have to communicate to each other and give explanation of your own vision of this situation. Yeah. So you have to study how to communicate and to make your idea clear to your colleague as well. Or it will be misunderstanding, misinterpretation of your words, and as a point of it, it will be problem with the treatment of your patient. Because when you will give some treatment, it must be like one head which is consists from the 3 ideas, yes, but one idea must born from the discussion, one for everyone. Other evidence shows that more than 1/5 of patients hospitalized in the United States reported hospital system problems, including staff providing conflicting information. The staff not knowing which physician is in charge of their care. Can you imagine? Once again, let's take imaginary situation when me and you two, where colleague will speak with one patient, maybe with pneumonia, why not? Yes, let's take something easy. So pneumonia, I say that, we have to do some extra examination, laboratory examination in tuberculosis center to avoid tuberculosis kind of pneumonia. You think what a stupid idea. It seems that the fever of this patient is normal, and at 7 o'clock it decreased, so it means no tuberculosis, why we need to do it. So, and begin to argue with me. The third one will say that it's okay, but we have to add cancer. Maybe it's not pneumonia, but cancer. Let's do something for it, and let's take medication, maybe chemotherapy against the cancer. Imagine what a chaos will be in our discussion and in our treatment. But in the end, if we will take the one idea how to treat, we have to follow it, or it will be that no one knows which physician is in charge of the care. So I will say, Edison know how to treat. I say it to Edison. You will say, no, not me, my dear. It's Sanat who must to treat it. Sanat, why you do not say the last medication to, do not send last medication to patient? Why me? It's EA's obligation. EA must send it. So we are 3 and no one treats the patient. Can you imagine? This misunderstanding at this point will take problem with the care of patient and treatment of patient. Okay. Over the past several years, we have been conducting original research on the impact of physician and nurse disruptive behaviors, defined as any inappropriate behavior, confrontation, or conflict, ranging from verbal abuse to physical or sexual harassment, and its effect on staff relationship, staff satisfaction and turnover, and patient outcomes of care, including adverse events, medical errors, compromises in patient safety, poor quality care, and links to preventable patient mortality. Many of these unwanted effects can be traced back to poor communication and collaboration and ineffective teamwork. Health professionals tend to work autonomously, even though they may speak of being part of a team. Efforts to improve healthcare, safety, and quality are often jeopardized by the communication and collaboration barriers that exist between clinical staff. Also, every organization is unique. The barriers to effective communication that organizations face have some common theme. Okay, once again, what we have? Team which work with the patient. What kind of team can be? Or the same professional, or multiple professional, or multidiscipline. Okay, it's slight difference. You see in our PPTs what differences is here. Okay, what happens then? It's good, yes? One head is good, two is better, as it's said. But when you cooperate, have collaboration with others, you have to think about the communication not only with your patient but between each other. You think that your opponent, your colleague, thinks the same way as you, but it's not right. It's personality. Some of them has their own ideas, or misinterpret your words, or forget part of it, or had no time to follow the changing in the patient care. So, if we three will treat one patient once again, one patient with pneumonia, and I write down some notifications that, oh, from the bacterial pneumonia, it's changed to the mycobacteria right now, and we have mycobacterial pneumonia. It's very rare for sure, that happens. So yeah, I note it down. Yesterday we treated like staphylococcus maybe. Now it's mycobacteria. It's antagonist, which is good for the staphylococcus, is very bad for mycobacteria. Mycobacteria grows on antibiotics, which kills staphylococcus. Can you imagine? So, but maybe you had no time, you were in rush, you somehow miss this notification and had no idea about new laboratory analysis. So you will follow the previous treatment, and of course it will harm your patient in any cases, and not improve the patient's situation. Understand? Yes? Okay. So what to do? It's very interesting what can be done. So, what can be done? In some organization, it's not only medical problem idea about the organization and communication. It can be everywhere in any kind of profession. Like it can be in the through the pilots. Why not? It can be in fire workers. It can be, I do not know others, but why not? Yes, it can be everywhere. So, in the world, everyone begin to think how to improve cooperation, how to change it. How do you think what we have to do? Guys, wake up and think. waiting. I gave you 2 minutes. Write me, please. How to do what, my dear? What it means, how to do what? How to cooperate, how to make team, how to treat your patient without any kind of problem, misunderstanding, misinterpretation, missing information which can harm your patient. What we have to do? How to organize it, team working.
Okay, I feel like maybe how would I put it?
Come on.
Maybe like organizing classes, maybe like every month on how to communicate to the patients better.
Every month?
What?
You say every month?
No, like yeah, maybe every month or like every year.
Every month, why not? I agree with you. Every month we have
Yeah.
to do some team kind of lecture. Yes, describe every kind of problems which exist through this month. Okay, I agree with you. What else can be done? In everyday working, isn't it good idea in the morning to cooperate and to share the ideas in the morning till you begin to work with patients? It was in the previous years and it's not bad to do right now, but something can be changed. What? You can not to meet each other, but do it by computer.
Maybe yeah, maybe by mail or sending out mails and all that.
Yes, and share to each other, but it must be obligatory to exchange ideas and to read these mails for sure. Or you will miss some interesting points changing, yeah? So it must be like we have now some lecture online, this online meeting, why not, must be. It can be 5-10 minutes only, but it will give you opportunity to not to do some mistakes. And if it is recorded as well, my dear, it will be the best way. Why record it? To avoid misunderstanding, misinterpretation, and misinformation. Yeah? Okay. So what else can be? Do you have any idea? Okay. Now let's read what is given to us. Okay, I found something. Let's read it. The barriers can occur within disciplines, most notably between physicians and the residents, surgeons and anesthesiologists, nurses and nurse managers. However, most often the barriers manifest between nurses and physicians. Even so, doctors and nurses interact numerous times a day. They often have different perception of their roles and responsibilities as to patient need and thus different goals for patient care. One barrier compounding this issue is that because the United States is one of the most ethnically and culturally diverse countries in the world, many clinicians come from a variety of cultural background. It's a very interesting point, my dear. In all interaction, cultural differences can exacerbate communication problems. For example, in some cultures, individuals refrain from being assertive or challenging opinions openly. As a result, it is very difficult for nurses from such cultures to speak up if they see something wrong. In cultures such as this, nurses may communicate their concern in very indirect ways. Culture barriers can also hinder non-verbal communication. For example, some cultures ascribe specific meaning to eye contact. Certain facial expression, touch, tone of voice, and nods of the head. For nods, for sure, you remember. You remember what and then I think you know this point that Indians and Arabs have, and we have not the same meaning. If we note head, it's okay for everyone, but for Indians, nodding on the side as well is that person agree with me. And in Georgian it means I don't know, let's see, I'm not sure in your words, I have to check it. Understand? Difference in the meaning, and it's misinterpretation. As well, if you will be in Bulgaria, it's one of the countries on the Black Sea, Bulgaria. Here, nodding of your head means no, and turning from side to side means yes, vice versa. So misunderstanding will be for sure in this kind of movement. As well, issues around gender differences in communication styles, values, and expectations are common in all workplace situations. In the healthcare industry, where most physicians are male and most nurses are female, by percentage, nowadays is like this. Communication problems are further accentuated by gender differences. And as well, if it is connected with a cultural, religious, and other kind of problem, can you imagine how big a misunderstanding and how big problems can exist? As well, you see here it says specific meaning to eye contact. Yeah? So if I will look on my nurse very directly in the eye, maybe by her religious and by her behaviors, she will misunderstood my expression and do something wrong. Yes, not the same which I'm meaning to do. Okay. A review of the organizational communication literature shows that a common barrier to effective communication and collaboration is hierarchical. How it is? Hierarchia in Georgian, hierarchios. Okay. Do you know what is hierarchios? That is vertical connection. We have in our university, it's not vertical but transverse hierarchy. It means that we have the same opportunity to do in the university and communicate with the patient, with the student and others as Mr. David maybe do. But vertical is that I can do nothing if my manager will not give me permission to do. Understand? Yeah. So this is hierarchy. Sutcliffe and colleagues' research concurs that communication failure in the medical settings arise from vertical hierarchical differences, concerns with upward influence, role, conflict, and ambiguity. Oh my God, it's too hard here. and struggles with interpersonal power and conflict. Communication is likely to be distorted or withheld in situations where there are hierarchical differences between two communicators, particularly when one person is concerned about appearing incompetent, does not want to offend the other, or perceives that the other is not open to communication. In healthcare, environmental characterized by hierarchical culture, physicians are at the top of the hierarchy. Consequently, they may feel that the environmental is collaborative and that communication is open, while nurses and other direct care staff perceive communication problems. Hierarchy difference can come into play and diminish the collaborative interaction necessary to ensure that the proper treatment are delivered appropriately. When hierarchy differences exist, people on the lower end of the hierarchy tend to be uncomfortable speaking up about problems or concerns. Intimidating behavior by individuals at the top of a hierarchy can hinder communication and give the impression that the individual is unappropriatable. Okay. Staff who witness poor performance in their peers may be hesitant, to speak up because of fear of relation or the impression that speaking up will not do any good. But we do not want to speak right now about the hierarchy. We have to speak about the team, which is named intra-professional. So, once again, we have a lot of kind of the team, and all of these kind of teams are taken to improve the patient's care. So, misunderstanding, problems which exist and which in the United States nowadays are in the first 10 top in the list of the problem and of the is a problem and the death point for the patient, must be changed. So what we have to do? Communication skills is very important, not only physician to patient, but physician to physician as well. First of all, you have to speak on the same language. Which language I am speaking about? It's not English, Arabian, or Armenian. No, it's medical language. So abbreviation, medical words, Latin must be in your language. Then every kind of changing in the patient health must be spread through the team. Every kind of information about the laboratory examination or other kind of professional examination must be exchanged through the team member. The best way of communication nowadays is internet or computer kind of. But here must be some rules. which is obligatory to everyone. Not to forget to share, not to forget to check the news on the portal drive or other kind of, I do not know which kind of, will be in the hospital. If you miss something, so through some hours, maybe some changing exists, do not forget and do not hesitate to ask about changing. Maybe something happened and mail is perfectly missed from the portal. Happens in our drive as well. When I send the mail to the student, not everyone receive it. Happens sometimes. Yes, maybe you will not receive, and you have to understand, if you are professional and you will be professional, that in some hours and perfectly in one day some changing can exist in the patient's health, and you have to manage it and change something in the treatment as well. Then, if you have to collaborate, if you have cooperate with other professionals, and you agree or don't agree with the ideas of others, you have to speak about it. You have to do the one line of treatment, the one way. In the end, if you do not agree with this treatment, give your description why, notice it on the drive as well, and do some kind of deal. If problems cannot be solved with the treatment that others give, you have to change it and think in idea your way of treatment as well. So cooperating between the team member must be as face-to-face, so by the drive. And it must be described who and what have to do, because you remember we said that no one knows who take care about something here. No, one will take care about the treatment and medication and communication with the nurses. Another in the team may take care about the laboratory examination and answers which are coming from the laboratories, and exchanging this new news to other team members. The third one can take I have no idea, intradisciplinary maybe, to other, to surgeon department, to other medication as well, to other doctors as well from other disciplines, yes, as well. So this communication, it will be easier to you because you are a team and every care about some different portion. But exchanging of information, what happens and what cannot be happen, is very important, because when some wrong point exists, maybe laboratory will not send you mail about the examination and so on, you will understand who must take care and who must find the way to take these ones. Yeah, or you will miss this news from laboratory maybe, and here's by example laboratory say to you, and patient health will not be improved, but will some harm will exist here. Understand? Yeah. So what else can be said here? It is some rules, and in every country it's its own rules. So I cannot give you right now the specificity of Georgia or other kind of. It will not be right. So, but in the hospital where you will work, you have to read. They will have their own portal, like we have our New Visions .g and so on. You have to read the portal, all the point, all the rules which are given here, and only after you have to take the work with the right way of working and communication with others. Okay, when in the where it was NASA perfectly, it's about the space craft and some other kind of problem which exists because he has as well a lot of employers which communicate to each other and misunderstanding is happens here as well as in the medicine. So they took everything on the internet kind of communication. Why? Because it's easy to find the problem because everything is recorded here. I do not think that it's a very good idea, but why not? Another point which is very important to us as well in communication, you must be not only educated in your professional skills, but as well you have to be intelligent people to understand the others' behavior and a religious problem. Not in cause you have to follow them, but in cause to understand which kind of misinterpretation, what kind of misunderstanding can exist between the members with this kind of problems. For sure, I will give you an example of one misunderstanding and misinterpretation between me and some students. In the very beginning, when I came to university, in cause of the difference in behavior between Georgians and Indians, I became not angry. I am not angry at all, but confused when my students are sitting with crossing the head in front of me. In Georgia, it's not polite. In Georgia, if you cross your hand in front of you, it means speak, I will not listen you. I have my idea and speak if you want. Okay, understand? Yes. So I took barrier between me and opponents. The same is in America for sure, and some countries of Europe. But Arabians and Indian students do it like behavior because in their school, they are taught to not to take, I do not know, mobiles, some different things to play, to sing. So they do it because of polite behavior to me. They want to be polite. They want to say that they will do nothing, only listen me. Understand? This is perfectly opposite sides. I think they did not listen me, and they do everything to show me that they are involved in this studying process with me. Is it misunderstanding? Is it misinterpretation? Of course. Why? Because I was not, and it's no shame to say it, I was not so intelligent to understand their behaviors. Then I read a lot, then I check something and understand their behaviors, and now I know that this kind of pose, it's very polite, and I thanks my student when they sit with a crossed hand in front of them. Understand? Okay, so what was the problem? The problem was that if in those period when misunderstanding this portion, I became angry and some miscommunication exists, it will be very bad. But thanks God, I had another idea. I carefully say that in Georgia, crossing the head is not a good idea to sit in front of the student, in front of the teacher. Please never cross hands when you are sitting on my lectures. Easy. Happen something? No. They open their hands, sit with their hands on the desk, on the back, on the knee, but for sure, now for me it's easy to communicate with this person. Understand? And we have some better way to communication. So if you cannot understand or you think something, always try to improve, try to check if you understand the person right. If you do not agree with the treatment, maybe argue, discuss with your opponent, or make deal, as I say, let's try and then change. Why not happen? Sometimes this changing is not deathful, it's not harmful to the patient, and maybe you will improve some uh, health of the patient. That's what I want to say to you today. The problem in the team working, the problem of communication, problem in the from the patient side, problem from the our side, kind of teams, and intra professional team working. Once again, in the exam will be multiple choice answer, which means from many answers only one, multiple answer, and it can be all the answers right, or 2, 3, or 4 right answers as well. Depends how many answers are here. So, and another one, the easiest one, true, false. Of course, it's one option, only right or true or false. So 50-50. Yes, we give this kind of question because the subject is not difficult and we have somehow to communicate and to understand if you read it. Okay, Dia, I think if you have no question, if you have question, please write it to me now. If you have not question, it's all what I want to say. And I will ask Salome where presentation uploaded and will upload new presentation as well. Okay, Dia. Have no question to me? Slides must be uploaded. Write to Salome Chiburdanidze to get information via perfectly these slides are uploaded. I know that she uploads them. Uploaded them. I had information that they are uploaded, but on which site we perfectly ask her. I think it must be or in the folder medicine or perfectly in your program. Not at all.